Hello, my name is Felicia Bieber, and for Module 1.7 Weekly Discussion, I chose to do my discussion on disease progression of HIV/AIDS. Before educating a patient, the nurse needs to assess the patient's level of education to understand information. The nurse should also consider the patient's preferred method of receiving information and whether a medical translator is required. According to the National Library of Medicine, patients may speak more than one language and prefer their education to be provided in their native language. The nurse may provide information using a combination of pamphlets, pictures, and paper handouts. Human immunodeficiency virus, also known as HIV, is a virus that attacks the body's immune system. Without treatment, it can lead to acquired immunodeficiency syndrome, also known as AIDS. HIV can be transmitted through the exchange of certain bodily fluids from an infected person to a non-infected person. According to the CDC, HIV is spread most commonly through anal or vaginal sex or sharing needles, syringes, or other injection equipment. HIV can also be transmitted from mother to child during vaginal birth. HIV is not spread through the saliva or physical contact such as a hug. An individual is at an increased risk for contracting HIV if the individual partakes in anal or vaginal sex without protection, the diagnosis of another STI, sexually transmitted infection, harmful use of alcohol or drugs, sharing contaminated needles, syringes, receiving unsafe blood transfusions, injections, or tissue transplantation, and unsterile cutting or piercing. Healthcare providers are at increased risk for accidental needle sticks injuries that may result in an HIV diagnosis. There are 3 stages of HIV infection. Stage 1. Acute HIV infection. According to the National Institute of Health, the earliest stage of HIV occurs 2 to 4 weeks after the patient contracts or is infected with HIV. The patient may experience flu-like symptoms, fever, headache, rash. In this stage, the virus attacks and destroys infection-fighting cells in the patient's immune system. These cells are called CD4 or CD4 T lymphocytes. During this acute phase, the infection is multiplying rapidly, and this increases the infection level in the blood. The patient is at a greater risk of spreading HIV to others during this stage 1. This weakens the patient's immune system. Patients in this stage are highly contagious. Stage 2. Chronic HIV infection. Stage 2 is called chronic HIV infection or asymptomatic HIV infection or clinical latency. In this stage, HIV continues to multiply in the body but at very low levels. The patient may not experience any symptoms of HIV. According to the CDC, people who take HIV treatment as prescribed may never move into stage 3, AIDS. Without treatment, HIV will develop or advance into AIDS. This process may take fewer to 10 years or more. With the treatment of antiretroviral therapy, also known as ART, this is a combination medication method to treat HIV. If the patient takes the medication as prescribed and maintains an undetectable viral load, which is the level of HIV in the blood, they have no risk of transmitting HIV to a negative partner through sex. The patient must take the medication exactly as prescribed, attend follow-up appointments, and get viral load monitoring labs. Stage 3, AIDS. The final stage of HIV is AIDS. AIDS is the most severe stage of the HIV infection. At this point in the HIV infection stage, the patient's immune system is severely damaged and unable to fight off infection. Patients are diagnosed with AIDS when their CD4 count is of less than 200 cells per millimeter of blood, or if they have certain opportunistic infections. Once diagnosed with AIDS without treatment, the survival rate is 3 years. Patients in this stage are highly contagious and may easily transmit to others. After providing information, education, allow the patient to ask questions and voice concerns. Ask the patient to explain in their own words the progression of HIV. Provide the patient with take-home material and resources.